Good evening, everyone. I welcome you all for our 16th webinar program organized by our Diagnopool team. We all lab professionals are exposed to potential risk due to exposure to corrosive and toxic materials, flammable solvents, high pressure gases, explosive chemicals, and dangerous microbes. The laboratory safety should come naturally and become your habit. Remember, you are responsible for your own safety as well as safety of others working around you. A little care and adherence to prescribed safety guidelines will help to avoid various laboratory mishaps. So today, we shall discuss about the laboratory safety management. To talk about this topic, I call upon Dr. Saurav. He is the consultant microbiologist and infection control at Ruby General Hospital, and he is CAHO representative for microbiology and NABH assessor. His main clinical areas are in infectious diseases, COVID-19, infection control, cardiology, neurology, critical care medicine, and critical care. His interests are hospital and healthcare management, process control, quality improvement, accreditation, assistance, audit, antimicrobial stewardship, and standardization. He is one of the India's first CSSD auditors. He also provides customer-oriented training and guidance in the field of healthcare engineering and hygiene. So over to you, sir.
Thank you for giving me this opportunity. And before I confirm, am I visible and audible? Hello?
Yes, sir.
Yeah, you're audible, sir.
Okay, thank you.
So I'll be moving the screens for you, sir? Or?
I am not able to see the screen.
Yeah, sir. Now I will just start.
Okay.
So can you see now?
It is still not visible at my end.
1 second.
You have to start the presentation, Divya. We could see the mirror image.
Okay, sir.
Yeah.
Fine, sir, now?
No, earlier we were seeing your screen, but you were not presenting the PPT. You can just present once more and start your screen.
Okay.
Yeah, we can see now.
Yeah. So very good evening to all of today. Our topic is laboratory safety management. Next slide, please. So before I start, I should tell what is in it. So you can see here, this is statutory caution. There will be backward stories and things that you mostly know, because many people have told you repeatedly and quite insanely, and I don't know whether we were following them or not, but yes, things that you know. And obviously that is guaranteed. Even these two are also go wrong. Another boring webinar, and I am sure you have successfully surpassed all those boring webinars by keeping your camera off. because सांस भी कभी बहू थी. So next slide, please. So before this is the question, what is your aim today? We know the time invested into the intensity gives our mission accomplished. Time invested to be 1 hour as per the schedule, and our aim is to know the safety protocols and to discuss about that. But what important is intensity, that depends upon you. So if you feel distracted, I would advise you please take care of that. You could have a food or drink, you could have others nearby, you could have push notification on your mobiles, or some unclear priorities might be there. So you take care of them before jumping into this webinar. Okay, that will help you to get. And obviously, yes, next slide. You can do it, I believe. It's not more than 1 hour. So who among us loves the stories? And these are obviously not the love stories, but these are stories. So start the first story. It is a histology lab employee was setting up a paraffin block. She put it in the microtome, and there was a foot pedal in the microtome, and she inadvertently activated it. What happened? Her left hand, which was not dominant, came in contact with the knife and amputated the tip of her thumb. Hello, anyone telling anything? Hello, am I audible?
No, sir, you can continue.
Yeah, audible, sir.
Okay. So you are following, or any part was missed?
No, we are good, sir. We can follow.
Okay. So it is a horror story that you watch in Netflix and other things. So it was a story that a lady histopathology lab employee was sitting on a microtome and with a paraffin block, and suddenly her foot pedal was activated, and it cut the tip of her thumb and index finger. What happened to that employee? She was hospitalized and treated for her injury. Obviously, it is a grievous hurt because the bone was lost. So this is our first story. So how do you feel? I think one or two person can give me a feedback after hearing this story, or you can. I think we can use the chat also. There is an option in the chat in call messages. You can use that. Anyway, the story is there, and we can. Yeah, it is really sad, very unfortunate. Yes. Okay. So there was a similar case happened in your hospital, Swati. Okay. So this is not a rare story. It is a common story, it seems. But let recap this story. What could happen? What was the unfortunate things were there? So what happened? It has a foot pedal, and probably she didn't care, or was doing some other thing, or maybe is distracted. Okay, so these things can happen, and accidents can happen actually. If you cross the road, you can have precautions, but definitely, despite that, accidents can happen. So this was one kind of such accidents. But what could be the learning lessons when you are dealing with a dangerous thing in a dangerous environment? The lab is very dangerous environment. So you could have grievous hurt, you could have loss of life also, or maybe a permanent disability. So this was our story one. Next, go to our next horror story. Okay, so now from the technologist, we move to a lab manager. So a lab manager, technician given a unlabeled 2 milliliter tube of clear liquid and was asking the lab manager, what is it? So the lab manager, as usual, the lady just open the tube and just block one nostril and smell through other nostril. It is a common thing in the lab. However, this time the experience was definitely different. The entire contents of the tube went straight up to her nose, and at this point she knew what was the mystery liquid. It was formaldehyde. So any reflection from you over this story? Please keep the previous slide. Yeah. Okay, you have done in PG days, but what was the effect? Did anyone, you did it yourself or someone did it? So what was here the lesson that could be averted? We can see, yes, when grossing to check the specimen was sent in formalin not. Very bad thing, because even the lab employee is not doing the work now. Whoever sending it, it was probably their fault or the fault in the process or the system. So what was the fault over here? If you go back to the story, it was an unlabeled tube. Okay, so labeling of sample, reagent or unknown fluids must be there. So that part was missing. There was no labeling. Second, what thing? It is our habit now to have a sniff. Many a time we also do doing the culture tubes. We just take a smell of the culture plates. But what could happen? Obviously, in 99% cases, you will be safe, because these are very rare things, but it is a lifetime event if it occurs. And believe what could happen to that lab staff. As far as I know, she survived, but it is a very dangerous thing. Next slide. So, how much secure do you feel now after hearing these two stories? I think you have done with your most of the day's work and probably leaving your workplace or still in your lab doing the evening duties and all those things. So how much secure do you feel now after hearing these two? See, the odds of dying in a plane crash is 1 in 11 million. Okay, so that is very rare. Okay, 50-50 chance. I don't know how I should react this, but yes, life is not secure, and it becomes more insecure if we do not follow the safety precautions. Next slide. Next slide, please. Okay, so you have to be aware of this previous slide. Hello, Diagnopool. Previous slide, please. I think we should go to back to the slide. What are your surroundings? We went a bit faster. Yeah. So, are you aware of your surroundings now? You could see so many signage over your lab. I'm very sure whether you follow it or not, signage are there. So there is an emergency shower, eye shower, then fire signs, PPE, spill kit, all those things, the evacuation plan, and reporting of accidents immediately. But they are there. But are you aware? If you are not aware, then nothing can help you actually. But if you are aware, if these things are not there, you can tell them. These all things are required. Emergency shower, very much required when the COVID started. Many lab had these things, although very much limited facility, but some could manage. An eye shower, it is very much important because if you get any eye injury, what you do? First you shower it and then take the necessary things. Similarly, fall, fire, very much neglected thing, and you can see fire extinguisher is there and hardly you can have the opportunity to use it. But what you can use, what you can check, it is expired or not, it is working or not. So these things are there and evacuation plan has to be there. Next slide, please. So this is a very common thing, I think. I do not know what happens over your place. A lab worker suffers a laceration or chemical exposure during a routine task and takes a deep sigh and gets right back to the work. How many you can relate to these things? We do not report because we have to do our work. And there happens the underreporting and all those things. There is a international lab safety culture survey was done, and what was shown, they use the term researchers. The researchers told, despite feeling relatively safe, 46% suffered at least one injury during conduct of their work. So we actually sustain injuries, but we never aware of that, okay, and we never report it. Next slide. So what goes wrong actually? That we perhaps all know. Let's see. Next slide. These things. If we can have multiple cards, we can have burn, and we fear underreporting or tend to ignore. So underreporting remains a thing where failure to report minor injuries and close calls. You know there are near misses where you could have injury but you just saved by God's hand. But minor injuries, these we forget and we don't record them. If you don't record it, you don't document this, then these things will be your hidden dangers. And that's why I tell everyone, you highlight your safety moments. You could have a near miss, you could have a major injury, you could have a minor injury, you have a close call, but please, you highlight it, you report this, because when we will work on this, we will have this data, how the event can happen. Next slide. This is a great thing, stale data. You know Sisyphus, in the Greek mythology, Sisyphus defeated death twice. And what was the thing he was given? He has to keep a boulder upon his shoulder and pick up in a hill, and the boulder again rolls back. And he again has to put it up in the hill. So these things, you do collect the data, but if you do not work on them, it goes, the cycle goes on, and it is a vicious cycle. You do a work, and then again keep on repeating the work. Okay, so just when you finish compiling and manipulating data for a report, the information often becomes critically outdated, and you are forced again to start over. Situation changes, the surroundings changes, your manpower changes. So the one statistician friend of mine told, when you are documenting a data, it has already become stale. You have to start afresh. So this is a habit. You have to work on your data and timely action has to be there. Next slide, please. Lack of buy-in. So we are very much negligent about our attitude. We must have a safety attitude. Okay. See, the lot many auditors come and all those things. The safety professionals might have been visited your lab, and any NABL auditor, assessors must have told you these things you do not do like this. These things you do not do. But do the workers follow actually? We also ignore why they do not know our environment, under what stress we work, under what environment. They just come for it and let's close the non-conformity and just go on whatever going on. But this failure to address these issues can create problem because this actually corrodes our safety attitude. And nowadays the assessors assess deeply what actually matters the workers. And if these two things do not work two way, then things will just go like heaping up. Next slide, please. Now, these things, I think this you will agree, working alone is a very much risk factor. And 80% of the researchers reported that people worked alone in their laboratory at least once a week. And this is an Western data, but in India, I think this will be for everywhere. And what happens when you are working? I just remember in my lab, one technician was doing the night duty, and suddenly he was not reporting to the ward. And so the ward people became furious because the patient was going downhill. And what they did, they just came to the lab. What is being happening? And they found the technician is just lying on the floor. They thought he might be sleeping, so they just shook him and discovered the technician is unconscious. Probably it was later discovered the technician had a seizure and he felt like that. And what happened? There was no one to report it. It could have been worse. We could save the lab technician, but if you work alone, these things will be there and this will be acting against your lab safety. So according to a research in the Journal of Chemical Health and Safety, active safety involvement of the lab supervisor, if it correlates significantly with lower number of accidents. You could save life actually. Next slide, please. Yes. We know many chemicals are there in your lab. Are you very sure you have the up-to-date inventory? Because when accidents happen, the first responders have no way of knowing which chemical identities and quantities are stored in a lab. So you will waste money on redundant ordering and subsequent disposal. At worst, inadequate chemical inventories have led to harmful exposures, fire, and even deaths. We have to know what chemicals we have and obviously labeling. Next slide, yeah. So these things, I think if you deny previous no causes, this thing you will be agreeing to much extent inadequate training. That's why Diagnopool has arranged this training, but I try to put this training in a separate way, not like a traditional. So when something goes wrong, it is always told this worker was not following the procedures. This worker is careless. Oh, the technician A. Oh, he always does that. Usually keeps on managing, but this time he failed. So there is a blame game going on against the employees. But what is the root cause? It is the inadequate training, not performing the classes is a thing, but training is what the teacher communicates. The trainer communicates effectively with the trainees. So what is the training needs? That has to be assessed. So focus group and feedback surveys can be very much useful tool in understanding the workers' perceptions of safety training. Otherwise, it could not have. When I was requested by Dr. Zubair regarding this training, I asked who will be the audience. And he told me that the lab workers, And I told, what about the time? Well, after they have the lunch at 3 or 4, then we can have at 5. Okay. So these things, very subtle question, but this actually help to assess your training need and how much you are eager to hear. Otherwise, all those training and all those resources does go into still. Next slide, please. Yeah, these things, I think you will also agree. Inadequate hazard visibility. If there were fire in one of your labs, could you tell a first responder exactly what dangers are present? How long does it take to answer that question? I think we can have spare a minute over this slide. Just imagine there is a fire where you are sitting just now and tell what dangers could happen, and you just think also how much time you spent over finding this answer. I think everyone is thinking. I hope there has not a fire where you are sitting just now. This is only a mock drill and not a real-time drill. Okay. Anyone answering? Trying to answer? Okay, it is taking time. So, yeah, very difficult to list out. And I told we should spend at least 1 minute. And why? Because in event of a first response, every minute counts. If we do not have our hazard visible to us, then how we can fight with it? So, a hazard must be mapped, and we have to have our eyes open, minds clear to see it, to fight it. Next slide, please. Administrative burden. So I think many of you are here collecting the blood samples, and this is a question for you. Have you filled in the sample requisition form properly? How long does it take? Honest answer, please. You need not to reveal any thing, but just
I think 30 seconds, sorry.
okay, 30 seconds. Anything more than that? Many labs have exhaustive sample requisition form like in COVID. You must have filled that. How long does it take? When first time you're starting a thing, how long does it take? When reading a prescription, how long does it take? So these things add up to our administrative burden, where you are not doing your work, but to do your work, you have to undergo these things. So these are called administrative burden. So here comes the lab of paperwork workers are required to fill out. And if they do not reduce it, we can have many manpower, but the effective utilization will not be there. And this will think, suppose you go to take the sample of this patient and you have a 2 or 4 page to fill up, then I will also be laid off kind of thing. And चलो इतना तो पेपर वर्क करना पड़ेगा, तो कैसे करेंगे? तो ठीक है, पेपर वर्क में ही तो सारा टाइम निकल गया, तो एक्चुअल काम में तो ज्यादा टाइम नहीं दे पाएंगे, टाइम दिया तो attention नहीं दे पाएंगे. There occurs the pre-examination errors also. And when you are doing earlier, needle stick injury can be much more there. Next slide, please. Poor equipment oversight. This is a very controversial issue and dangerous issue simultaneously, because we have so many pieces of expensive, delicate instrumentation spread out across so many locations. and we just lose the track of who is using what and where. You could have the thing in Excel sheet in your computer or you may have displayed, but we have to have into our mind. But we fail to keep the track of these things. And the critical equipment needed for work gets broken, falls out of certification, or ends up in the hands of untrained users. What is the danger in that? If we do not track them, what could be the danger? Suppose a novice technician comes, like that microtome, maybe handling that, maybe handling a freezer, maybe handling an autoclave. What will happen? Dangers. The safety risk will be there. So tracking should be correctly and consistently. Now, ineffective lab inspection. Yes, this is one thing. You could have seen the lab inspectors, whoever comes and just goes on that tick, 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 tick. These things are okay, okay, okay. So it is a box checking tick list, and whatever time I will spend only 5 minutes. Isn't that more? 1 minute? Okay, so in 1 minute I have to fill these 10 pages or like that. So just put on tick, 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 all those things. But clearly this inspection is ineffective. Why? It is not well prepared because workers are always skeptical of the safety advice. We tend to ignore that. I was telling before. I do not know about your attitude, but it is a general attitude that we feel we are very deterrent to safety advice. देर इतना सारे बोल जाएंगे, इतना कर पाएंगे, न करने की जरूरत ही क्या है? वो तो इतना तो डेंजरस नहीं होता, कोई तो मर तो नहीं जाता, ऐसे तो इंजरी तो नहीं होता है. These are our attitude. So we are always skeptical about our safety advice. But this lab inspection becomes effective if they communicate to each other and feels what are the actual improvement points, where the danger points is there, and obviously the workers do trust on what the lab inspector says, and there happens the effective lab inspection. Otherwise these things will just go on like the Sisyphus, put up that boulder and it again rolled back. Next slide please. Okay, so I think after the stories and this so-called cause, now is a play time. So are you ready to play with me? Let's see what puzzles we have in our front. Next slide. Oh, we have a problem of a working centrifuge. So you load some samples into a centrifuge, turn it on, and continue your work. After some time, you hear a knocking noise coming from the centrifuge. You have never heard it before. And to your horror, you notice the centrifuge is just walking on the table. Now, what should you do? Have anyone seen this kind of thing? If not, it could happen. Na? So what will you do? Are you following?
Yes. Yes.
Okay.
Switch off the
Miss Divya, let me told the switch off the centrifuge. Yes, any other person holding that centrifuge back in the position? Calling other people, announcing a code. Okay, great. Ms. Divya has rightly pointed out we have to switch off the centrifuge. And after that, what should you do?
check for balance.
Yeah, that's the thing we miss. We just switch it off and open it to see what happened. Never do that. It is rotating. It is in motion. So after you switch off, it will come into static position after some time. So please allow that. And then you open. Otherwise, you could have invited a more danger. The things will just splash off. You will be the victim. Okay, so currently we have solved the first problem. We have to switch the centrifuge first. So we can go to the next problem. Lab is full of problems. Okay, from centrifuge to autoclave now. You just run a liquid autoclave cycle. You open the autoclave and you see your bottles have exploded. They are all broken. Liquid has spilled out. Now what should you do? Okay, someone has left, so that could be an option. You could leave the lab. Any other person who are in lab now, what you will do? First, I think we should wear our PPE and inquire what was in the liquid, because you may not know that was the COVID sample. It could be a corrosive also. So there is a spillage issue. That is one thing, we have to address this spillage. Second, what could be the possibility of this explosion? They usually don't get explosion in the autoclave, not the bottles. So what could have? Yes, someone was telling. Yeah, you can use your mic one at a time. You can use your mic. Yeah, I would love to hear your inputs. So here what I do observe, many people just after switching it off tries to open it. Yeah, Miss Swati doing that right thing. 10% hypo or 1% hypo, whatever your spill management tells, you have to do the spill management. So that is first part of the problem. Second part is why the bottles are broken. So might have happened many a time, particularly if your worker is not conversant with the machine, they just open it when it has not cooled even. So that causes a pressure difference and that can happen. The bottles might explode and that could be a reason over there. Or the third reason, the autoclave was not properly maintained. The technical issues could have been there. So see, this is just an incident, but the answer might be different depending upon circumstances. So you have to know what could have gone wrong. Okay, but still we have solved this problem. At least the spill part we have solved it. So we should go to the next problem. Okay, now this is a hot plate. The power cord to one of your lab stirring hot plate has become brittle and frayed. I think they are like that only. Now, one afternoon the power cord begins to smoke and catches on fire. And your lab coat has got that fire. You are just a spectator. What should you do? How many of us recognize this is an emergency? You can raise your hand, like I raised my hand. Okay. Miss Jayalakshmi has raised. Okay. So at least we identify this is an emergency. This is a fire. And the lab mate is on fire. So what should we do now? Two things are there, no? You can see what I could see. You could see other things also. But from this problem, I could see two things. One is the fire. One human is burning, getting burnt, and another is a power cord that is still on. So probably I would switch off the power cord first and tell my lab mate to remove the lab coat or to lie down on the floor so that the oxygen can be cut off. Any other thoughts? This is my thought, just came after seeing this problem, because this is an incident and we have to act fast. Are you enjoying this or feeling bored or kind of? You can use the chat also. There is an in-call messages option over there. You can use it. I am following those. So you have to switch off. Okay, thank you, Diagnopool. So we have to switch off it and also simultaneously take care of the fire. Now let's go to the next problem. Lots of problem we have. Yeah, that was also blank wall, yeah. Anyway, we have to cut off the oxygen. Yeah, correct way, see, it depends upon the situation, your lab protocols, and your awareness of your lab protocol. These things, three things are there. So, based on my practice, you first switch off the source and then cut off the fire. These two things has to be there. You can follow any sequences, but usually from our infection control, because I see like that, we are more concentrated first on the source control. Your power cord has got fire and it is still on. Next slide, please. Okay, now we are in the sulfuric acid. You are moving a concentrated sulfuric acid from its source container into a test tube. And suddenly, the big bottle just rolled onto the floor and contents are spilled on the bench and floor. Luckily, none has got spilled. You are safe. Now what should you do? Just ignore, just mop it up, just keep it confined between you and probably one or two spectators who saw it. So here happens, if we do not do anything, the spill will be there and next person will be the victim. There's the acid spill going on. We have to manage that. Yeah, Miss Lubna, Mr. Lubna Modasir, we have to have the knowledge of our spill kit. But do you know where the spill kit is there in the lab? Many people tell the housekeeping knows. But where is housekeeping at the time of emergency? Yeah, sand we can use definitely, but this is a chemical spill. So whatever containment measures you take, you have to neutralize it. So sodium bicarbonate, you have to pour it to neutralize it and then transfer this chemical spill into a water spill and then you mop it up. Next problem, please. Okay. So this is my favorite. You just splashed a human blood sample in your eye. Perhaps the most common question also, what should you do?
Eye wash. Using of eye wash.
Yeah, but when I hear this eye wash, do you have an eye shower?
Eye wash
Many-
container.
Yeah, eye wash because we are very much fantastic, awesome. We do eye wash, all those things. Safety things, we usually do eye wash, but we don't have any eye shower. If we do have, we have to have, and we have to know where it is located. Okay, so you have to wash your eyes, and it is a mucosal exposure. Great, Maheshwara Reddy, you have. So You have to have it and also know it. And if you do not have, you have to have a backup mechanisms for which it can happen. And it's a human blood. So we have to take all precautions, all those battery of test, serology test. If HIV positive, then bad luck, but post-exposure prophylaxis is there. And before that starts preparedness, we have to have our hepatitis B vaccination done and our titer tested annually. Next slide. Anyone having this problem would tackle? A member of your lab is unplugging one extension cord from another when her metal necklace catches on the exposed prong, and the employee is thrown to the ground and actively being electrocuted. This is emergency. I think nobody can deny this is not emergency. This is emergency, but what should you do now? Great, Asif Pasa. Yeah. Diagnopool, use a wooden stick. We have to cut off the source and then we have to call the emergency. There is no time to waste in doing our researches on that. So we have to cut off the sources, and please be sure you are safe, because many a times happen to save one electrocuted person, other two persons just go on electrocuting. You must have seen the film Hera Fairy. Anyone can remember? So
Yes.
you should not increase the problem. So next problem, please. We have many problems. This is the winter day problem. So you are working with ethanol, pouring it a 1 liter beaker, wiping your hands, and there are no tissue paper, and just you wipe your alcohol hand on your sweater, and just you turn on your hot plate in a fume hood, and you get burned. Ethanol was on your sweater, and it has got the static electricity has worked, and it has got fired. Now what should you do? Obviously, you take care of the fire and never repeat these dangerous adventures next time. Okay, next slide. Hydrochloric acid in your eyes. Yeah, you have to take emergency physician's advice after washing your eyes properly. Next problem. Okay, so here comes the last problem. We don't have any problem left, and our employee just slipped over a wet floor and can't get up. What should you do now? Who will just keep him fallen over like that and go to work, go your work? Okay, no one is going to leave him alone. Okay, so what will you do? You will help your offer, and next time you keep this caution board visible to all. Many a times caution board is there, but we do not look into them. We have to look into them, and we have to do our work properly. Okay, because these things you can break your brains. Okay, next slide. Yeah. So lab is full of problems. We have solved many problems, but many problems are still there. So what I could do to give a helpful tips, but these tips are only good if you follow. If you do not follow, the tips will be here in all. Next slide. Okay, so here comes, you are a Superman. You have to know your role. You have a role. It may be documented or it may be presumed, but you definitely have a role and you have to know it. You have to know your limitations your permissions, and your protocols. Next slide. Yeah, there is a dress code, and the lab dress code includes the PP. To save our nose, we have the respirators, mask. To save our eyes, we have goggles, even face shield. We have gloves, we have gowns, we have closed or covered shoes. And usually it is advised do not wear shorts in the lab because they are not obscene as per, but these are dangerous. You could have danger. Next slide. We wear PP and we keep on. When not to wear your PP? In the lunchroom, in the bathroom, using your office computer or using your cell phone. Because see here, what happens when these were cultured, these grew so much germs. So I think all of you are not wearing the gloves and holding your phone while attending this webinar, because otherwise these things will be there and these are also part of our safety problem. Next slide. Yes, this is a thing we have to build the habits. We should not eat, drink, smoke, chew gum, apply cosmetics, or remove or insert contact lenses while in the lab. We should not store food or beverage in the sample laboratory refrigerator or the chemical refrigerator. The mouth pipetting, earlier it was so much rampant, but now with the help of auto pipettes and all those, we do not do this mouth pipette. But yes, if you are running an academic institution, you might have these things, but you should not practice it. And these things are your life skill. Wash your hands before leaving laboratory or after handling contaminated material. Next slide. There are some safe practices. Do not use chipped or cracked glassware. That could be dangerous. When working with a hazardous material, have a second person nearby. Do not do alone. You may be novice, you may be experienced, but please keep another second person nearby when you are working with a hazardous material. Know the emergency procedures and these things that keep the laboratory neat and clean. It will save many of your expenditures and life actually. And use hazardous chemicals under a fume hood and biohazardous materials under a biosafety cabinet. I know COVID has taught us how important it is to use the biosafety cabinet, and we must remember the lesson because the new phase of pandemic probably is coming up. We do not know what will happen, but what we know that we already know what we have to know. We have to practice it and decontaminate as needed. And aerosol, it is very much important, and we do not see this aerosol now. We just smell it up, sniff it, and become ill. So all procedures which generate this aerosol, we have to minimize it. So adhering to the protocols, to the policies, this will help in minimizing aerosols. Next slide, please. Yeah, how to store the chemicals? You can see OA stands for organic acid, B for pyrophoric acid and reactive materials. The X is organic peroxides, which require separate cabinets or cupboards. And if you have shelf, in the upper shelf you can have a corrosive. In the lower shelf you could have the flammables. So this is a good thing we can follow to keep our things, and this looks also neat and clean and also safe when we are working. And always keep a list and your MSDS, the material safety data sheet, ready with you, because these things that will help you in time of emergency. No one, nothing else. Next slide. Fire. We often ignore. And see, fire is a lifetime opportunity or risk. If you can overcome it, it becomes an opportunity to save yourself and others. Or if you fail, there is no time to repent. No one will repent. Okay, so there are classes of fires, and we have to use approved fire extinguisher for the correct use of the fires. Mostly we use the multi-purpose, that type A, B, C, but many places do not have all those things, and you have to check the expiry dates, the pressure, and the types you are using. If you use wrong thing, then there is again no time to repent. You are gone, along with all others. Next slide. Rules for sharp. Sharp injury is there, and as we know, sharp can transmit deadly infections like hepatitis B, hepatitis C, and human immunodeficiency virus. Hepatitis B, we are protected somewhat by taking vaccination, but other two we do not have, and they usually progress to cancer and lifelong problem. So what is the rule for sharp? Never bring two hands together if one is holding a needle. You should not recap it. You should plan safe handling and safe disposal, make clear movements when taking the blood. Patient may be restless, patient may be dependent, patient may be unpredictable, but you make clear movements and explain the procedure to the patient. If it is a child or person who is not capable of cooperating, to ask for assistance. Next slide. Yeah, we are always after money. And who spends money uselessly? No one. So we have to spend money wisely. You have to appoint a trained safety coordinator. We need to have conducted a safety risk assessment, and that should include biosafety. Chemical safety is, and physical and general safety is an integral part of this risk assessment. The new NABL ISO 15189-2022 will be telling mostly about how to assess this risk and to convert this risk into opportunity. The establishment of the competency for safe working has to be there, whom to be privileged. Provide safety orientation and continuing education for employees, and that has to be effective education. Regular safety audit has to be designed and done. An occupational health program to address safety incident. It is a continuous work, and we all are part of it. It is not the lab manager or quality manager alone doing that work. We all are part of it. We have to report every incident, every near miss, so that final outcome is for our benefit only. Next slide. Yeah, I think all have slept or left. Anybody still awake? Okay, only Diagnopool is awake. Oh, okay. Many. Okay. Thank you. Any question? I would love to answer if you have any question.
So one question, sir.
Hello. Any question? You have any doubts to clear or anything? You can blame me also, because you cannot beat me because I am far away and on a digital platform. But you can, blame me. Okay, thanks, Miss Pravina. Anything you learned or anything that changed your perspective today, that will be, I think, that will be take away from for me from this webinar, because ultimately we are not working alone. We are in a group. Yeah, Miss Divya has a question: how to discard vacutainers? How do you do? I'm sure you are not storing it up. For Dr. Maiti will taking this webinar, and after that we will implement. So what are you doing now? Ms. Dibba, you can unmute yourself and can tell.
Sir, generally, what everywhere it is following is we discard the vacutainers in the red bag. And actually, what is another, this one is we have to pre-treat before discarding in the vacutainers. So we are treating it with sodium hypochlorite, we are supposed to treat. So in some assessors are told to close the vacutainers and then treat it with the sodium hypochlorite solution. But some assessors are told that you have to remove the tube and then treat with the sodium hypochlorite. But actually, there is no standard. We are not aware which is the standard way of discarding the vacutainers.
Okay. So as I told, we have to see your circumstances. If I prescribe a way, you may not follow it. Because best way, I think you should autoclave it. If you have your waste autoclave, you can autoclave it and then put it in your red bag. And why it is required? It is legal. Biomedical waste rules are legal way. So there is no chance that you will be spared if they found anything wrong. And what the rule tells, you may have waste autoclave or pre-treat it. What pre-treat facility you have? Hypochlorite. Now this hypochlorite will do pre-treatment of what? Not the vacutainer vials, but the contents.
Yes.
Yeah. So if you want to pre-treat, you have to pre-treat the samples, what inside in it.
Okay.
Only spraying outside, it is not pre-treatment.
But then removing it and discarding all, it becomes more dirty and...
Yeah, that becomes more safety risk, so that you can tell, that you can defend. But definitely the most safe, as we follow and as we see to follow, you to use the waste autoclave.
Okay. Thank you.
Thank you for this question. I think many of us confused, and the assessors also make us more confused.
Yes, sir. Actually, in most of the inspection, this question is compulsory these days.
Yeah, actually what happens, even the assessors also are puzzled because the assessors also not from the subject area. We all have our weak points and strong points. So clashes can happen, but yes, we have to follow what the rule is and how our best approach can be to tackle that solution. We are all helping each other. We are not blaming each other.
Yes, sir. Thank you, sir.
Thank you.
Thank you, Dr. Saurav. Very interesting and lively presentation. I think everyone enjoyed. And the topic I thought was boring when I gave you, but you have really changed the perspective of this topic, and it's very nice. I think everyone enjoyed it.
Okay. Thank you.
Thank you once again, sir, for such an interactive question answers and story session. I thank each one of the attendees who have attended this program during their busy schedule and making this success. Thank you, sir.
Thank you. And thank you, Dr. Zubair, for inviting me to this platform.
Yeah, most welcome.
And it is very much good, I think.
Yeah, we'll call you again.
And all audience are so attentive. I thought with my boring lectures, they must have slept. But there was some second person probably.
A topic for all the technicians and all the lab professionals who are here. Yeah. It was very, very important because it was something safety rules which we are talking.
Yes. So Dr. Zubair and I had a talk over several instances. What should be the topic? What should be the topic? And then finally, I think we were fighting over it 2 to 3 days back also, or last week. What should be the topic? Whether it's infection control or safety. Then I told the safety look sounds good. So Dr. Zubair, yes, I also feel that. And that's why this webinar is the product of that thinking. So this I am sharing because during a webinar, attendants, whoever, they do not get to know what background story goes on. So as this was a storytelling session, actually, this was not a learning session. I thought let's share the background stories also.
Yeah, absolutely. Thank you. Please
Thank
do the
you.
feedback form. Yeah, thank you.
Thank you, sir. We'll
Thank
end
you.
the session. Thank you, sir.
Thank you.